Hello there, thanks for joining us on a special TV report on Gladiators Track with Acorn. Today is a special focus, and with us here, Nigeria is indeed blessed with great people, exceptional people, doing exceptional things in the health sector and the engineering sector. With us there is a focus on Professor Oladapo Ashiru, OFR, and also a special note from Dr. Ladi Awoshika. And also looking at the engineering sector is none other person than the key player in the mining industry, the person of Alhaji Adebayo Yusuf. I bet you will enjoy it. Stay tuned. Healthy living, they say, is basically the major determinant of wealth, and for you to run around with hope in your mind and happiness in your system, you have to find comfort in the place of good health. This, as a term that drives human existence, is the reason why we have active doctors and professors of medical practice in and outside Nigeria, making the continent of Africa proud. One of them is Professor Oladapo Adenrile Ashiru, who is making his mark in the medical line, not only as a professor of anatomy, but also a great researcher, working effortlessly to bring succumb to the face of women and couples generally having fertility challenges in the conception of a child as a significant contribution in the field of reproductive endocrinology. Is in the elucidation of mechanism controlling pituitary gonadotrophic FHL's release, which is basically the science behind infertility management and in vitro fertility IVF circle. He pioneered the IVF program in Nigeria in 1984 as his team successfully delivered the first test tube baby in Africa in 1986. He was appointed consultant reproductive endocrinologist to Lagos University Teaching Hospital in 1980, and he became a professor of anatomy in 1983 as the youngest appointed professor of medicine in Nigeria at the age of 32, with over 25 years of experience in the management of complex infertility cases, 15 years experience with ICSI and new assistant reproduction technologies, while he also has 28 years experience of in vitro fertility called IVF. As a man of repute in medical research, he was reproductive endocrinologist in the Department of Obstetrics and Gynecology in Omaha in 1978, as he obtained a joint appointment with the Department of Anatomy and Obstetrics and Gynecology at the University of Illinois at Chicago, UIC, at professional level. Professor Ashiru is currently the CEO of Medical Arts Center, a clinic that specializes in reproductive endocrinology and fertility. He has devoted the last couple of years in preventive measures on fertility and anti-aging measures through lectures, newspaper columns, contributions, and several publications on reproductive health. He emerges the first Black Secretary General of International Federation of Fertility Society IFS Executive Council for the 2022 to 2025 period. He is the president of the Academy of Medicine Specialists of Nigeria and also president of the African Reproductive Care Society.
I feel elated, I feel overjoyed because not that it's like breaking a glass ceiling, and not that there is a glass ceiling, but that one has been able to create an awareness and a pathway for others to follow. A pathway in the sense that the International Federation of Fertility Society is a federation of fertility practitioners of various countries coming together, and it was founded about 64 years ago, and at that time there were just about 5 countries represented: United States of America, Britain, Germany, South America, and France. So as more people got into the act of using high technology for infertility care, they formed a society in their country and they became members. But all through this period, there were no black countries represented. Nigeria were among the first black countries to be, in fact, indeed the first black country to join this society in 1992, when myself and Professor Giwa Osage attended a conference in Venezuela. Before then, with our success in vitro fertilization from 1984, we had been attending the meeting just as observers. And then in 1992, following our success, we were formally admitted as a member. And for all this period, we would just attend as members, and then eventually we got to become members of their executive council, maybe in the scientific committee or in the board. But this is the first time that we will hold that high office of the Secretary General given to a black person, and it's a recognition of the contributions that we from this country have put into this field, and also of the way that one has interacted with them for them to find it. I was humbled and overwhelmed that they deemed this fit, and I was pleasantly surprised. Almighty behind you, everything is possible. And the saying is that put your trust in the Lord, believe in Him, and do the hard work, and everything will come to pass. When we were practicing the act of assisted reproductive technology at the Lagos University Teaching Hospital and the College of Medicine, the support was not too forthcoming. It was a little at a time. So it was my vision that if I'm able to have an opportunity to have a place where I could do a lot with good infrastructure, then I can achieve more. So that was what actually made me to relocate to United States of America. And practicing assisted reproductive technology in the United States of America is a joy, because you see that the industry has come to your aid. All the things you have to do by hard labor, like making the glass pipette and things like that, the industry came, they made it into plastics and made it easy. And by the time I was coming from United States of America to Nigeria on vacation, and to see some of my patients that are left behind, I realized that there was more use for me in this country, because in America there are thousands of IVF clinics. But in Nigeria, in Chicago alone, where I practiced then, there were about 72 IVF clinics. So it was available. At that time, we were the only IVF clinic in Lagos, the one in Luth. So we both decided to go and have a private center, and that was how this started. And so when I decided to relocate back to Nigeria, I took a number of my retirement package and acquired equipment, bought a number of equipment to set this place up. Well, it's very, very simple. I had a very, first of all, having been a medical doctor, you have a clinical view to issues. Now, when you go into research and you have to get a doctor of philosophy and research, you have a scientific view to issues, and science is always straightforward and proper. So you have to go by quality, you have to go by quality management, quality assurance, and quality control. So all this together ensure that with your scientific background, you're always doing research. You are not satisfied with what you have today. You are thinking of how to break barriers, how to do new things, how to improve what you're doing. And when you're doing that, you are busy knowing what others are doing. And when I was doing my doctorate research, that is the level of training that is imbibed in you in the United States of America. You have to know what others are doing your research. Otherwise, if you don't and quickly change, by the time you finish your research, you find out it's still news, that it's been done. And you don't want that. So you quickly adapt and break new grounds. And that is what we do here. We always make sure that we are breaking new grounds. At the end of each process, we evaluate the cycle. We want 100% success rate for all the patients that step in here. Patients. And 2 or 3 of them will get pregnant. And everybody will be celebrating, yeah, we made it. But I was always looking at those who did not make it and say, let's see what happened. What was different? And that has led to a number of awareness today that, for example, some of those who did not get pregnant, they did not get pregnant because they had heavy metals in them, like mercury, because they were taking large fish, or taking stockfish, or they did not get pregnant because they had heavy metal, because they were driving their feet, the car with bare feet. When you drive the car with bare foot, the pedal on the accelerators and the brake, they are made of, they contain heavy metal called antimony. And this heavy metal is poisonous to the embryo. So the patient may not get pregnant, even though you are transferring very good embryos, they can miscarry. So it is such understanding and study that makes you want to know why they are not getting pregnant, and therefore you're able to help them because you discover why, and then when you remove the insult, they end up getting pregnant easily.
The health sector, is a system, as it were. However, a system with the right operational policies, ab initio, requires maintenance, monitoring, and evaluation on a continuous basis. Whenever these aforementioned processes are not observed, internalized, and carried out as statutorily stated or ensconced in the policies of healthcare, we end up with a continuum of crisis, and this is what has been playing out. So it's not that those things just erupt out of there. It's because of the failure of certain parts of the system The serial crisis stem from health human resources, that is personnel, discontent, disillusion, and material inadequacies, which means they can't do their work the way they are trained to do it. So you can say, okay, it affects them. So if you are not seated at a desk that gives you all the things you need, that says you can send people to do tests there and get the results immediately, then you start getting disillusioned and discontented. That's when you now even remember that your child you haven't paid the school fees of your child, that is, if you are working in the government hospital. So all those things now combine to create disillusionment among the health workers. They keep talking about the same thing every year in, year out, and very little actually gets done. That's why those strikes and the system. It's not rocket science at all to resolve these issues. It just requires the ownership of the issues by those who are supposed to address them. Ownership of the issues and transparency in resolving the misallocations. You remember either some months ago when the Minister of Labour said we didn't have a problem with doctors in Nigeria. Doctors can we have too many doctors. Yeah, but that's a doctor who's saying that, which we know is wrong, because there are many doctors out there without jobs. So what should they do? They leave the country. Well, you should know that worldwide disease patterns keep changing for many reasons, with old diseases along with the introduction of new ones, just like COVID and all these things. So some of them are infectious, some of them are non-communicable, but because of lifestyle, environment, all kinds of things, we're now having a lot of things that are affecting us. And this have become a big problem. Our disease surveillance in the country has thankfully been ratcheted up, maybe because of the COVID thing. At least that was a good fallout, but a lot has to be done in terms of training personnel, giving them the tools for disease surveillance, and making sure that they are content. That it's not that after you have trained them, you didn't give them the tools, then they also disappear to another country. So this is a double-edged sword. We've got to train, we've got to be ready, we've got to be tracking diseases. There is yellow fever, Lassa fever, so they are all there. We have to be monitoring them to keep them in check. If you don't have disease surveillance, then we are not going to be able to address these issues. And when you also remember that there are many diseases that are born out of poor environment, poor housing, poor nutrition, so these diseases have external and internal ways in which they affect the general health care of the population.
Speaking, you see, who's an engineer? Broadly speaking, an engineer is a person who is trained to be able to design, build, construct, supervise, and vet the quality of the job done to ensure safety and endurance of the project. You see, broadly speaking, engineering is so broad-based that there are different categories. I'm a mining engineer. About what is commonly known to people, an engineer, like I said, is somebody who design an engine, build road, build bridges, construct airports, construct urban works, and the rest of it. But there are other level of engineers: chemical engineer, electrical engineer, automotive engineer, and the rest of it. Basically, I'm a mining engineer, and as a mining engineer, there are other related professions like the geologists, the structural engineers, the civil engineers to develop infrastructure in any mining space. So broadly speaking, as it is today, Nigerian mining engineers are fully engaged mostly in quarrying and construction. Wherever there is any infrastructure development, that's where we are. My company actually is a service provider to that infrastructure-based engineering. Like I said, my company produces explosives as a key input to relate to producing those construction material, building material, and the rest of it. And as it is today, we need all broad range of machinery and equipment to be able to effect and carry out the successful mining. So also like other construction-based work or civil engineering, what have you. So there will always be a counterpart between the locals and the foreign. We don't have the equipment, we have to import the equipment. We need the services of the Nigerian local mining engineers and the civil engineers to do all this kind of thing. And to develop a mine or develop a quarry is a highly technical, involved activity. And then today, I can tell you, we have universities, our University of Technology, our Polytechnic, churning out mining engineers, mining technologists, and the rest of it. To an engineer, as it is, we have to still work together with our foreign partner, foreign counterpart, and the rest of it. So, but with the Nigerian government emphasizing input of local content, all effort being made is to be sure that Nigerians and local raw material are actively involved in these construction activities, mining activities, civil engineering activities, and what have you. Across the country, all our roads crossing are in terrible state of disrepair. They are calling, begging seriously for rehabilitation, for reconstruction. So the government surely needs to be more serious and focused because there's a gross deficit of infrastructure. Our roads are not safe, our bridges are not safe, we cannot travel safely, and unfortunately the whole situation is compounded with all this insecurity. We just hope that the incoming government and our leadership will for once take all this thing much more seriously to encourage the Nigerians who are engineers, all field of engineering. There is the body of engineers, the current, that is the Council of Original Engineers in Nigeria. And under that current, there are other subdivisions. The Nigeria Society of Engineers, Nigeria Society of Mining Engineers, Nigeria Society of Chemical Engineers, we have Nigeria Mining and Geosciences. These are related to mining, Nigeria Society of Mining Engineers. We have a law that actually has been enacted that ordinarily, if it is well implemented, will surely better the lot of engineers in the country. But unfortunately, the reverse is the case. They are not being thoroughly patronized. There's a serious discrimination. And this, unfortunately, as we got along the line, I'm sure we'll get to other aspects that will probably address what I want to say. As it is, the laws are okay, but the implementation of those laws, the people to put it to work, because there is vast development of quackery in every facet of engineers, in all fields of engineering, even in medicine, in pharmaceutical, in education. Lack of conscience, lack of commitment and focus, and lack of priority, lack of patriotism rather, that government, those who are in government and leadership, are not doing the needful to encourage and motivate the locals. The law is not always the problem, but how to implement it. The act and regulations are there, but implementing it and getting it to work is always a challenge. unfortunately, let me look at it this way. If you look at the 70s, early 70s, during the Gowon administration, you could see a lot of development work, infrastructure development was concentrated in Lagos and some other areas of the country. And going up to 1980, when we have a lot of nationalities, the German here having construction company, we have the British, we have the Israeli, we have the French nationality, all having construction company here. As time went by, the economy and the Nigeria indigenization decree got a stage where most of these nationalities were disengaging from our economy. The German, of the like of Julius Berger, has been very, very resilient and consistent, still remain today. But basically, all the French construction companies are no longer here. The Italian company, the Bateau, the Kappa, all these other, they are no longer here. George Wimpy of the British, Fuji Roll, Spibatignoli of French, all of them disappeared. When they went away, that was the point Nigerian government ought to have encouraged and motivated Nigerian engineers to get involved in developing and constructing our infrastructure. But unfortunately, there was a complete disconnect. The Lebanese took it over.
And that's about it from us to you. Thank you very much, and I believe you enjoyed it. Don't forget to follow us on our YouTube channel on Gladiators Track with Akon. And we wish you a happy holiday. Please stay safe. Thank you very much.